Welcome to Restoring Education in America with Priscilla Rahn. She's a master educator and author, leading the conversation to restore the American mind through wisdom, virtue, and truth.
Well, hello, everybody. Welcome to Restoring Education in America. I'm your host, Priscilla Rahn, and I am so excited that you've decided to join the conversation today. I wanted to remind you as we get ready for summer and parents are going to graduations and celebrations that there is a new private classical school that's opening this fall in Centennial. It's called Excalibur Classical Academy. I am the headmaster. I am so excited. We're opening kindergarten through third grade, and our mission and vision is restoring America's heritage by developing servant leaders who are keepers and defenders of the principles of freedom for which our founding fathers pledged their lives, fortunes, and sacred honor. Something really exciting that we are also sharing is that all of our inaugural families will receive 100% tuition assistance. So join us this fall. Go to our website. It's excaliburclassicalacademy.org. And one thing that I really love about the classical model is that there's actually classical PE. Who knew that there was a more traditional way of teaching physical education? And at Excalibur, we are going to have physical education every day in addition to playtime. And I am so excited to bring my next guest to the stage to talk all about health, wellness, classical PE. And he's my doctor, Dr. John Pitts. Hello, Dr. Pitts.
Hey, Priscilla. Thanks for having me.
It's so great to see you. I know you're in the middle of patients, so we're going to keep this quick. And I'm going to share a little bit of your bio with our listeners. So Dr. John Pitts is a board-certified physician in physical medicine and rehabilitation and a specialist in interventional orthopedics and regenerative medicine at the Centeno-Schultz Clinic. He earned his undergraduate degree from Emory University and his medical degree from Vanderbilt University School of Medicine. He completed his residency at Emory University and now serves as a fellowship director, helping train physicians in advanced non-surgical orthopedic treatments. Dr. Pitts focuses on musculoskeletal health, spine care, and sports medicine with expertise in fluoroscopic guided procedures and diagnostic and interventional ultrasound. He's actively involved in research and the development of regenerative therapies, and he has published in peer-reviewed journals and presented internationally. He's also the author of Nutrition 2.0 and has been featured in the documentary The Motivation Factor. And I think I deserve a medical degree for pronouncing all of those big words.
You did awesome.
Okay, so for my listeners who don't know, you are my doctor. You have helped me so much with PRP, which is platelet-rich plasma. Real quickly, talk about the work you do at Centeno-Schultz and what PRP is.
Yes, absolutely. So here at Centeno-Schultz, we focus on treating orthopedic type problems, trying to get patients to avoid surgeries. So these are things like knee arthritis, hip arthritis, shoulder arthritis, ankle sprains, rotator cuff tears, ACL tears, spine injury. So joint pain in the neck, or low back, radiculitis, bulging disc, those type of issues. And our focus is on doing treatments that allow the patient to allow their bodies to heal themselves rather than just pain management. And then hopefully the goal is avoiding surgeries, avoiding more invasive techniques, and getting longer and better term improvements if we can get the body to heal itself rather than just do pain management, which can help, but also comes with a lot of different side effects. And so PRP is just one of the modalities, one of the more popular modalities that is used nowadays in regenerative medicine. You pronounce it great, platelet-rich plasma. This is essentially taking out some of your blood, concentrating these cell fragments in your blood called platelets. So every time anybody's had a cut or a wound and it was bleeding, that blood clotted up, it got a little scab, a scar went away, your platelets did that. So we can take advantage of the healing factors in platelets by concentrating them out and injecting them in different areas where you're not getting enough healing to stimulate healing and repair.
Very, very clinical explanation. People don't really realize how fun and funny you are in person, but that was a very good representation. You are not just a doctor of PRP and all of this, orthopedic medicine. You are a leader at Centeno-Schultz. You do a lot of research. You're at the forefront, which is why I'm personally very comfortable with you. I have been an athlete, a tennis athlete, a bodybuilding athlete. I've actually had back surgery, but I remember the first time I came to you for PRP and it was just like, oh my goodness, I feel so much better. And now I am a convert, and I'm excited to come see you again in a few weeks to just get another touch up. You got to get touch ups, right?
Right.
What can people expect when they do come? I mean, it's not necessarily, it could be a one and done, but sometimes you see patients repeatedly, right?
Right. Well, I think, we kind of jump ahead to the treatments, whereas, the most important thing is getting an accurate diagnosis. So we're going to spend an hour time with you, figuring out what's going on, what's the actual problems. Do we have all the imaging and tests that we need? If we have all that, we can come to a complete diagnosis, and then we can put together a full treatment plan. So just in very broad spectrum terms, PRP tends to work very well for mild to moderate problems. Like, say, for instance, mild to moderate knee arthritis. We have more than 40 of the highest level studies, randomized controlled trials, showing PRP can help with that. It's not a cure for arthritis, but it can help pain, function, preserve cartilage, slow the progression of arthritis, and that can help out for several years at a time. So, which means, hey, if you get PRP in your knee for mild knee arthritis, it helps. You might repeat that every 1 to 5 or more years. For spine issues, same thing. PRP can help really well with mild to moderate spine issues, for said arthropathy or joint pain, radiculitis, bulging disc, spinal instability, things like that. And it can help out for several years at a time. And, occasionally you might need a tune-up or repeat, or sometimes you might need 1 or 2 procedures in the beginning just to see, if you get that full maximum improvement. Because basically all we're doing is stimulating the body's healing mechanism. So it really depends on that patient, their goals, how well they do their physical therapy and take care of themselves and not have injuries.
I was going to say how good of a patient you are in listening to the doctor's orders of doing the physical therapy.
That's right. Because it's not just about what we do as far as injections, but also about what you do as far as taking care of your health, diet, nutrition, physical therapy, good posture, having those good, healthy spine habits is going to be important too. And staying away from car accidents if you can help it.
Yes. Well, yes. Okay. So the reason why we're having a conversation today is because I'm opening up my new private classical school, and I started looking at different curriculum. And someone who has a physical education curriculum said, have you seen this documentary called Motivation Factor? And I said, no. So he says, oh, it's on Amazon. Go ahead and check it out. So I started watching it, and I was like, wait a minute. That's my doctor on the documentary. And so, of course, I was already a fan, and then I became this bigger fan. And you were talking about, first you started out talking about your mom's journey. You were really transparent about your mom. And then you started talking about sports and the importance of sports. But for people who haven't seen this documentary, it's going back to like the Kennedy era of physical education and really strengthening students and making that a priority in the school day and how that has impacted education. But talk a little bit about, how were you invited to be in the documentary and why your mom's story was so important to your journey?
Yeah, absolutely. So the filmmaker, Doug Orchard, he had done some videos for our clinic, so some marketing videos. And so, we knew each other from that. And so he invited me to be a part of the documentary. I think also I don't know if you know this, but I was a physical education teacher for a year before I went to medical school. So that was my first job out of college, was actually teaching PE. So that was fun times for elementary school students, 3-year-old up to 8th grade. So my mom, the story about my mom is that she contracted polio when she was 5 years old. And so after that disease, she lost the ability to walk for the rest of her life. So when she was younger, she could use crutches. When she was older, she got more into a wheelchair. But, they never stopped her from being active, from doing things, from starting a mixed abilities dance company. And so she's always been a strong motivating factor. Hey, there's no excuses for you not to do what you want to do and succeed. You can always overcome obstacles. She's a big proponent of me being involved in sports. I was played a lot of baseball and football when I was younger. So she's just a big factor in multiple ways, because that's my mom and she raised me by herself. And so she's 100% the reason where I am today.
Wow. Okay. So you did refer to sports, and, when you look at physical education in a school setting, there's a wide variety of things that you can do depending on what your schedule looks like. And I would venture to say that physical education and health is a little bit different than being involved in sports. But what would you say would be the importance of also incorporating being a part of a team sport in your physical growth?
Yeah, well, I think we got a lot of evidence to suggest physical activity in general is important for students' academic performance. So it improves test scores, it improves classroom behavior, it improves brain health and brain development or neuroplasticity, just making new connections in a child's brain. And that can increase blood flow to the brain and increase the hormones that are involved in signaling. So we know it has all these amazing health benefits for children. And that spills over into education as well. Where sports comes involved, I think, is just being a part of something more than just yourself. Have to rely on other people and get used to other people, because we're all connected. We're all one people. And so the more we can kind of connect with others and work as a team, I think that's helpful for building camaraderie, because there's no career you go into where you're not going to have to work with other people, face obstacles and challenges together. So I think that sports team adds an extra dimension to it. Not everybody's going to want to do that, but I think that's very helpful for those who choose to go into sports.
I've kind of gone down this rabbit hole with physical education curriculum. So I interviewed a gentleman who was the founder of Iliad Athletics, and I really like his approach. And then one of my mentors said, "Have you heard about this book? It's called Games, and it's from the 1930s." So it's really, really old. So I found it on eBay, and I was looking through the table of contents, and one of the chapters says social and quiet games. And I really like the quiet games. You remember, it's like, that's an actual game from the 1990s. It's like, okay, kids, we're gonna play the quiet game, right?
I love that one.
I haven't actually read the chapter to know if that's actually what it is. But going back to your teaching days, because I didn't know you were an actual teacher as well, what would you encourage today as you've seen changes in PE requirements? Because technically on paper, you're supposed to have PE every year, every day in public school. Some kids, there's a lot of loopholes. But what do you think should change curriculum wise that you're seeing in public education?
Yeah, well, I mean, I definitely think that, PE should be something that's mandatory every single day for students all the way through high school. I remember in high school, we had PE every single day. And it just helps get a lot of energy out. I mean, I have a 7-year-old boy, 5-year-old girl. That boy is nonstop 24/7 running around. Like, he has to get some energy out and helps him focus and helps him feel better and stay healthy. So I would require physical education needs to be something that's required, or at least some type of physical activity required every single day, even if it's not going to the PE teacher, just having recess and playing outside, et cetera, because that's going to improve the academic performance. It's going to make the teachers happier because the student's going to be more easily behaved and listening. So I think it's just a win-win for everybody. We think that, we need to focus more on math and reading scores. Well, adding more physical education actually can increase those scores. So that would be my vote if I was in the politics, but I'm not.
They make that point in the documentary that somewhere along the line, that student who maybe wasn't doing really great in math or reading, they gave them extra math classes and extra reading classes in the day and took away PE, thinking that was going to solve the problem, when actually the opposite is true. Giving them more physical activity actually helps them, then rather than taking that away, because like you started out saying, the neural connection. I, as a music teacher, also see that connection. There's something about physical and art really helps the brain. Don't you think?
Absolutely. Yeah, absolutely. So yeah, unfortunately I didn't have any musical talents whatsoever. My dad was a drummer and musician, and my mom can sing and dance, and they didn't pass anything on to me. But we try to at least get our kids into piano and music, because I think that activates different parts of the brain and creativity. And so even as a scientist, you'll think, oh, that's just kind of boring lab research stuff, but you have to have some creativity in everything that you do. And so I think that sparks those areas of the brain. So that's certainly not my specialty, but I'm all for, I try to get my kids active every day, try to get them involved in music and just multiple things. So hopefully we turn them into some good, well-rounded adults.
That's good parenting, Dr. Pitts. So I've heard people in the education field say there's a difference between structured physical education and free play time. What are your thoughts about what's the distinction between recess, free play time, and structured physical education?
Yeah, that's a good question. I don't know if I know the answer to that. So I think probably both are important. So with free play, again, you have to cooperate with other people. You have to kind of problem shoot. What are you going to play? Who are you going to play with? So I think that has its own merits. And then some structured physical activity. Maybe learning a particular skill, learning how to move your body in the correct way. So maybe it helps your postural form, or when you get into lifting weights or working out, you have that foundation. So I think both are very important. So I would think both should be included every day, or as much as possible.
In the film, they talked about jumping is a good way of building bone structure. I hadn't heard that. That was new information for me, because as a former bodybuilder, we learn that you don't want to start weightlifting too soon, because you have to give your body time to grow. I think I've heard.
Yeah,
you can correct me. You're the one with
that's a myth.
degree.
That's actually a myth now.
Is that a myth?
So,
okay, when's it good to do some weight training?
Yeah, and so I don't know if you see it was one kid who was like a bodybuilder. He was like 5 years old. You ever seen that guy?
Mm-hmm,
he's like totally normal, tall. Right now he's kind of out of all that. But yeah, that's a myth that is some certain age limit. Now I don't think kids need to be lifting weights when they're super early, but I think around 12 or 13 is probably a good time frame where they got the mental capacity to kind of listen and be safe and do things. But even my 7-year-old, I got a gym in the basement, and he'll come down there sometimes in the morning, and I'll show him a couple lifting weights, and I have him lift 5 pounds or do some pull-ups and things like that. And I don't have any concerns that's going to affect his growth at all. So you can start early, but I think at least around 12 or 13 is probably a good, where maybe you get more into it, where it's kind of more formal.
So what would you recommend as I'm building our playground at Excalibur Classical Academy? And, our teachers, we won't have enough students yet to hire a full-time PE teacher. So our teachers are going to have to learn some basic things to teach students to do. What would be some great games? Like I was thinking like jump rope, basketball. These are easy things. Hopscotch. Are there some other games or tools that you would recommend for a new elementary school?
I mean, I think having that playground there is good, because kids will make up their own games, and they'll make up their own kind of thing. So the more diversity of the playground, where they can do different types of movements and get used to climbing and have some kind of fear, risk, reward, where it's like, hey, this is a little risky. Can I do it? Can I not? I think those are going to be important. I'm big into the sports, so I think, hey, if you can have some basketball there, I think jump rope is a great thing to add, hopscotch. Because those are things that are easy. You can draw, little games where you can maybe toss something in the bucket to work on coordination, anything like that. So I don't think you can go wrong. So as long as you just have a variety of lifting things that kids can do to keep them interested and engaged, they're going to make use of it.
Okay. Now, you're a doctor, you've got 2 young kids, you send them to school, and then next thing you know, you get a call from the headmaster saying, I'm sorry, Dr. Pitts, your son just broke his arm because he fell off the monkey bars. You're like, do you get upset, or do you go, boys will be boys? We kind of expect, they'll be a little,
Yeah, that's funny. I mean, luckily I haven't gotten that call yet, but a very good friend of mine actually got that exact call. I mean, he was maybe 5 or 6-year-old, fell off the monkey bars and broke his arm. Of course, your initial reaction is like, hey, who's watching? How did this happen? But at the same time, kids have to kind of learn from some mistakes. So if it's something where the kid is completely unsupervised and nobody's around, then that's one thing. But if the kid's kind of supervised, you can't watch 20, 30 kids at once. So if the kid was doing something that they were allowed to do, but they just had a mishap, I'm not going to blame the teachers or students for that,
Yes, because sometimes, nowadays it's almost too safe. There's like too much hovering
Yes.
around kids where you don't allow them to, be boys or be girls or be rambunctious, like.
I've had my little girl, she had a little buckle fracture of her arm. Because she was doing something she wasn't supposed to do. She was jumping around at swim class and probably slipped and fell, not listening. We didn't even see what happened. But her consequences were she had a little brace for 2 weeks and was healed up. If me and you happen, we out for 2 months and we still might be having problems a year later.
Now, does she get PRP, or like what kind of treatment does she get?
No, she's 5, so she heals up fine. Her stem cells and platelets are working well, so she doesn't need me.
That's hilarious. I was joking with our founder when I saw because the play sets these days are immaculate. They're so beautiful and they're like safe. And I said, what happened to the hot metal slide where you burned yourself going down, or the teeter totter where you got a concussion because every time you went to the bottom? And when we chuckled about it, because like we got bruised every time
I'm a little more old school. I'm a little bit more, hey, make it reasonably safe, but not extra safe. Don't have everything soft pattern, because children got to learn some risk reward and like, hey, what can I do? Sometimes some kids learn the hard way, and that's the only way they learn. So I'm definitely not advocating for kids to go out and break their arms and fall all over the place. But they should be able to exercise, so show some caution without overdoing it, where, hey, they don't get used to consequences because, every time I fall, it's a soft surface, I don't even get hurt. Then they take more risky behaviors when they get older.
Well, I guess that leads to my next question, Dr. Pitts, of the age range of patients that you see. I know you see adults, obviously, but are you seeing more young people too, younger patients who are coming to you, or maybe not necessarily to you, but in general?
The majority of patients we see, I'm an adult doctor. We treat adult problems. And so, we'll see. So teenagers, though, for certain. The youngest person I've probably seen was probably 7 or 8. And this is more because I treated the kid's mom. She had neck problems, and we treated her successfully. And so she brought her son, who actually had some neck issues as well. And so we actually did do PRP for him, and it was very successful. Sometimes little kids can get away with something simple like prolotherapy, so you don't have to draw their blood. So definitely we don't try to recruit children to the office, but sometimes we just have friends or family members or patients like, hey, my child has this and not getting better, and we'll treat those kids, and the kids do phenomenal because they're already young and healthy, and have good healing mechanisms, so they can do really well.
Do you think in general, in the medical field, are more kids going to the doctor because they're less healthy? I mean, we can go into that whole conversation about health and nutrition and the new pyramid and all that, or is it just kind of still status quo about the type of young patients that go to the doctor?
That I don't know. I think we've seen a lot more student athlete kind of injuries because of early specialization of kids. So, kids start playing soccer at 4. That's their primary sport now. They're doing soccer year round, don't play too many other sports or other activities. And so by the time they're 14, 15, 16, they're burnt out. They're playing at the school team. They're playing in the traveling team. They're playing year round. So they're likely more prone to injuries that way. So I think there's been some research coming out that just shows, hey, diversifying kids younger. So just, hey, allowing them dib and dab in multiple sports when they're younger. And then only specialize maybe when they get into that upper middle school or high school area. They'll peak a little bit better. Well, if you specialize earlier, you'll specialize earlier, but then you'll peak earlier, and then you're more prone for injuries or burnout and fatigue. So I think that's kind of the biggest thing I'm seeing is that, hey, you're seeing more sports injuries in young athletes, and I think it's because partially due to over-specialization early on.
Well, I would imagine if you were giving advice to the general public, to parents, that you would say, make sure your kids are getting plenty of sleep and plenty of rest to recover. What other advice would you give to parents, especially parents of athletes?
I would say, hey, again, try to get them involved in multiple sports when they're younger, even if they know, hey, I'm a basketball player, I want to go to the NBA. Great. Play basketball in the regular season, maybe a little bit in the off season, work on some skills, but get involved with several other sports, or at least if you have the ability, work with a trainer or work with somebody that can show them different type of exercises if possible. But I just think diversifying the students' activities in general, it's going to be a win-win, and just keeping kids active, period. So if you're already a parent of an athlete, those kids are active. So probably don't have to worry about that, but I would diversify the activity and at least try to teach them proper form as far as working out, lifting weights, so you don't develop compensation issues as they get older.
Wonderful. Well, Dr. Pitts, we got to land our plane. Where can people find you? What's your website, and how can people follow you?
I'm not so much on social media myself, but our clinic, Centeno-Schultz.com. I know Centeno-Schultz has an Instagram page as well, and a Facebook page. And then, when you're a patient of mine, you have my direct cell phone, email address, etc. So just at Centeno-Schultz.com and on Facebook and Instagram.
And you guys are located in Broomfield. That's your one office.
Correct.
Right?
Yes.
Okay. So you guys are in a beautiful facility, wonderful staff, very attentive, and I can attest 5-star treatment and a little bit of comedy too. And right before you go to sleep, there's wonderful conversation.
Yeah, pull out my bad dad jokes.
Well, thank you so much for sharing your wisdom and expertise. I'm really looking forward to my next treatment with you, because I always get such wonderful results. And to my listeners, thanks so much for tuning in. Catch me next time. And remember, educating the mind without the heart is no education. So seek wisdom, cultivate virtue, and speak truth.
Thanks for tuning in to Restoring Education in America with Priscilla Rahn. Visit PriscillaRahn.com to connect or learn how you can sponsor future episodes to keep this message of faith, freedom, and education on the air.